The recent deaths of Justin, Vicky, and Xiao have sparked many important conversations, with topics ranging from ego lifting, improper spotting, and other gym safety precautions to the importance of pushing for a new 1-rep maximum for lifters outside of an actual competition. We'll touch on each of these points in today's video, and I'll break down both tragedies from a detailed medical perspective, with guest appearances from the one and only Coach Greg Doucette, as well as Aaron Horschig of Squat University here on YouTube. Before we get started, I would like to extend my deepest condolences to Justin and Xiao's family and friends. Please note, though I do not intend to show the actual injury footage, our analysis will benefit from examining the moments preceding it.
Okay, before you watch this freaking video, like it! Like the button right now!
At first glance, this scene looks fairly unassuming. Broad daylight in what appears to be a public gym with a total of 275 pounds on the bar. As Coach Greg points out,
he places his camera, he's videotaping his lift, probably wants to post it on social media to perhaps brag or celebrate the fact that he's able to get this lift.
The fact that he was filming himself on a potential PR gives strong evidence for the case of ego lifting. And unfortunately, according to the Daily Star, Xiao had previously been employed at the gym and kept a key that let him enter the gym before it opened and would exercise alone. And due to the absence of safety pins or bars in the lifting rack, when Xiao cannot lift the weight, there is no one around to help him out from underneath the bar until it is too late. The owner of the gym found the 27-year-old pinned by the barbell when he arrived to open the gym for the day. This is as far as Xiao is able to lift the weight. It rests for a moment on his chest before the barbell slowly rolls onto his neck, where it remains stuck for a full 2 minutes until the video ends, though it feels much longer than that. And as far as trauma goes, this injury unfolds unbearably slowly. Before we break it down, I'll let Coach Greg point one more thing out.
So you can see a pad in place. That pad is there to help him arch his back. He perhaps was a powerlifter. He's trying to decrease the range of motion by arching harder than last time.
So perhaps Xiao was emboldened by a sense of previous experience to attempt this lift without a spotter. It is my understanding that by incorporating an arch, powerlifters can decrease the range of motion and facilitate the lift, as Greg mentioned, mitigate pressure on the shoulder joint by directing the force to the top of the glenohumeral joint rather than the posterior aspect, recruit muscles from legs, torso, and abdomen more effectively, and create a slight decline pressing angle, which many people consider to be an easier lift. But with such a prominent arch and the pad and lifting belt to a slight degree, ensuring that his arch is maintained, he has increased the probability of the barbell rolling onto his neck. The cylindrical bar just cannot rest on his declined slanted chest. Any heavy lift attempted with this type of technique should be done so in the presence of sufficient spotters. The heavier you go, the more help you'll need. Attempting a PR alone, especially with no safety bars in place, is ill-advised.
Once the bar on his neck, there's not much he can do. I've seen people get in this position before. Sometimes they're lucky, they manage to squeeze their way to the side.
There is definitely sufficient weight on the barbell to fracture the cervical spine, and it might have done so had it been traveling faster. For example, if Xiao had dropped the weight on his neck suddenly, but because he fails at the bottom of the rep and the weight rolls slowly onto his neck, the cervical spine and spinal cord within it remain intact. We can be sure of this because his arms and legs continue to contract and spasm as he begins to lose consciousness, more energetically at first and slowing considerably as the injury progresses. If his cervical spine had been fractured and spinal cord transected or severed within it, everything below the level of injury would be flaccid, including his respiratory system. Ever heard of the saying, C345 keeps the diaphragm alive?
I understood that reference.
Meaning, if you break your neck at that level, you can no longer breathe for yourself. That's where mechanical ventilators come in, acting as bellows to move air in and out of your lungs. Unfortunately, avoiding a broken neck is no consolation. With the 275-pound barbell still in place, asphyxiation occurs rapidly. This term describes the state when the body does not have sufficient oxygen, which may be caused by allergic reactions, drowning, foreign objects blocking critical air passages, or crushing the airway, as was the case here. Although the trachea, or windpipe, is made of strong, flexible cartilage, it is not equipped to deal with this much force. When a person becomes asphyxiated, the body responds as though it is under attack, and non-purposeful movements or even seizures may occur. Essentially, the body is trying to defend itself, but there is no real sense of cognition, as the brain is deprived of oxygen, which, as we've already established, cannot enter the body. As the video progresses, we see Xiao's head begin to turn dark red, since high pressure blood from his heart, which is pumping rapidly in fight or flight, can still make it past the barbell into his brain, but none of it can get out. The arteries that carry blood from the heart are high pressure vessels, while the veins that carry it back to the heart are low pressure. We've got a couple of problems on our hands. First, as the blood collects in the head, blood pressure rises in the brain, causing acute hypertension or high intracranial pressure. This alone can damage the blood vessels in the brain, potentially leading to ruptures, hemorrhages, microbleeds, and even stroke. Worse yet, the brain, which is very sensitive, is being deprived of oxygen at the same time. Brain tissue can begin to show signs of injury within seconds to minutes of oxygen deprivation, and after about 2 to 4 minutes, significant brain damage can occur. Prolonged oxygen deprivation beyond roughly 5 minutes can lead to irreversible brain damage. Again, within 2 minutes before the video ends, we can be sure this process is well underway. Once Xiao is unconscious, we can be sure that the brain tissue is beginning to sustain damage, though not necessarily dead just yet. In this video, his muscles continue to twitch a little bit as fasciculation, or spasmodic muscle contraction, is possible even once consciousness is lost. To put it bluntly, the CPU is going haywire before it powers down completely. When the video ends, he's not clinically dead, and the heart may still be beating, though it will stop fairly soon, likely within a few minutes. A heart that stops beating can be revived by CPR.
No, Rose. They are not breathing, and they have no arms or legs.
And can beat again even in the absence of brain function, since the heart has its own pacing mechanism.
Okay, too fast. We need to pump at a pace of 100 beats per minute.
That's hard to keep track. How many is that per hour?
Technically, this might help a patient live and their blood circulate, but if the brain has sustained catastrophic damage, nothing can be done to bring it back.
You might be thinking, yeah, but he was ego lifting. I won't happen to me. I only put on a weight that I know I can do. What about if you tear your pec? Have you ever thought of that?
Echoing Greg's sentiment, the risks of attempting a heavy, for you that is, weight on bench press, especially with a prominently arched back, without proper safety precautions or a spotter, are extremely high. Unfortunately, even in the presence of a spotter, heavy lifts can go wrong. This very lift cost Indonesian bodybuilder Justin Vicky his life. We can see that he has 210 kilograms or about 465 pounds on the bar and steps back out of the squat rack in order to perform the lift. Again, we've got the camera set up, setting the stage for an ego lift and perhaps a new PR. Despite the presence of a spotter, the weight is just too heavy for him. He cannot lift it.
And when spotting a squatter, unless you have the safety bars, as in you're squatting within the rack, you need a minimum of 3 spotters.
Thanks for the reminder, coach. This is because the squat is a difficult lift to spot effectively, especially as the weight climbs into 1 rep max territory. If the weight falls backwards, the spotter isn't going to simply catch 465 pounds, especially if the spotter has improper form. We see here he is gripping the bar from beneath with supinated forearms as if to curl the weight. I do not intend to blame the spotter for this accident, only to illustrate that given his leverage on the bar alone, there's nothing he really could have done to assist Justin's lift in any meaningful way. This is why 3 or more spotters are present at Olympic lifting competitions.
And even with 3, things can actually happen. With heavier weights at powerlifting meets, we have 5 spotters.
Since in most cases, 5 people will be able to lift the weight up completely. I recognize that in your everyday gym scenario, a 5-person spotting team may not be feasible, but safety bars or pins are usually available as a fail-safe mechanism. If they aren't, even some changes to spotting technique may have made a difference.
The hand should be on either side of the person's chest and or stomach. If they can't get the weight, you're basically grabbing onto them and going up with them.
Very literally, like a 2-person squat, as Coach Greg goes on to mention. But to be honest, this positioning of this spotting technique can be awkward and may still leave the lifter vulnerable. In fact, the argument could be made that the presence of a single spotter impedes the lifter's ability to throw the weight backwards if they need to bail on the lift, as YouTuber Crispy Chicken with Bacon demonstrates here. In Justin's case, the spotter falls in a seated position behind him at the moment of failure. And had Justin attempted to jump forward, the spotter may have sustained a serious injury. Sure, an injury to the legs or knees is preferable to a fatal accident, but both of these eventualities can be avoided. So from here, Justin falls back into a seated position, and the weight, which is situated high on his trapezius muscles, rolls forward onto his neck, quickly forcing it into deep flexion. Among lifters, there is plenty of debate about low and high bar squatting techniques. As Aaron Horschig from Squat University explains here,
if I have that barbell sitting on top of my trap muscles right here, that is a high bar back squat.
And then if we position the bar lower, we're talking about a low bar technique.
Couple different positions, but most commonly, people will pin that bar over the middle of their shoulder blade.
In his video on the topic, Aaron explains how this choice in positioning influences the mechanics of the movement.
Typically, powerlifters will use a low bar squat because the longer moment arm creates more leverage about the hips, allowing some to lift more weight overall.
I'll spare you the mechanics for now, as we'll still need to break down Justin's injury. But suffice it to say that when it comes to a 1-rep max or maximal load, most powerlifters opt for a low bar technique for a reason. Before we move on, I will add that from a medical perspective, a bar positioned higher on the neck is more likely to roll forward and force the neck into flexion. And for that reason alone, when lifting heavy or attempting a 1-rep max, it is worth considering a low bar variation, which facilitates the aforementioned forward bearing motion. But even more important and practical than that, just use safety pins. Now, let's talk about Justin. When a significant weight or force sharply flexes the neck, it can result in various types of cervical spine fractures. These injuries can include compression fractures, which involve the collapse of cervical vertebrae, burst fractures that crush the vertebrae in multiple directions, fracture dislocations causing both fractures and dislocations, and even hangman's fractures, typically associated with hyperextension, but also possible in flexion injuries. These fractures often pose life-threatening risks, including spinal cord injury and paralysis. This is because the cervical spine serves as a protective barrier for the spinal cord running inside of it, safeguarding it from injury so that it may continue to transmit signals between the brain and the rest of the body. When the cervical vertebrae are fractured or dislocated, the spinal cord may be transected or severed, cutting off the flow of information from brain to body at the level of their injury. Remember when I mentioned the phrase C345 keeps the diaphragm alive?
Staying alive.
Well, after reviewing the footage, there is a high likelihood that Justin's injury occurred around this level, and his spinal cord suffered catastrophic damage.
Okay, he's dead. Anyone know what we do next? Anybody?
The automatic breathing process, typically controlled by the autonomic nervous system, would have stopped, leaving Justin incapable of introducing fresh oxygen into his respiratory system. As mentioned earlier, It is possible to survive an injury to the spinal cord at the C3-4-5 level, though not by repairing the damage. Instead, a portable mechanical ventilator may be used to breathe on the patient's behalf. Christopher Reeves survived for 10 or so years in this manner after suffering an injury at the C2 level. But this is a minute possibility and depends on how fast medical care can be delivered. We're really racing against the clock here. When the body is deprived of oxygen, vital organs fail in a predictable sequence. The brain, being the most sensitive, starts to deteriorate within seconds to minutes. The heart follows but can beat briefly, while prolonged oxygen deprivation can lead to cardiac arrest. Over hours or days, other organs like kidneys, liver, and gastrointestinal system may fail. But Justin wouldn't have had that long. Vicky was reportedly rushed to the hospital where he succumbed to his injuries. In a similar situation to Xiao, who oxygen restoration was likely not fast enough, and the brain had been damaged beyond repair by the time the medical team attempted to resuscitate Justin. I'm sure that neither Justin nor Xiao were considering the grave possibilities associated with a failed 1-rep max attempt when they first lifted the weight. But who is? But with so much at stake, the importance of safety precautions when attempting to set a new PR cannot be overstated. In my humble opinion, before attempting to set a new PR, it may be worthwhile to consider your reasoning for doing so. If you're competing in or training for a powerlifting competition, I'm going to assume you've paid ample attention to safety precautions, spotting and bailing procedures, as well as taken the time to assess your potential maximal load and probability of success. If you're training for strength, hypertrophy, general aesthetics, or longevity, does setting a new 1-rep max really serve your goals? There is plenty of research floating around out there on what type of load is optimal for specific goals. Do your research. One such article by Dr. Brad J. Schoenfeld et al., published in the February 2021 edition of Sports, suggests a new paradigm whereby muscular adaptations can be obtained and in some cases optimized across a wide spectrum of loading zones. In other words, their research challenges assumptions that lifters often make about what type of load is conducive to what type of muscle gain, suggesting that we may not be as confined to the repetition continuum as previously thought.
Whiteboard workouts, motherfuckers.
Perhaps a 1-rep maximum or a new PR isn't as integral to getting stronger as conventional lifting wisdom might suggest. But I mean, even by conventional weightlifting standard, the 1-rep maximum exists at the far end of the repetition continuum, and a target rep range that is low, for example between 2 to 3 repetitions, is well within the strength. This lift will increase my strength range, only far less dangerous. For most non-professional weightlifters, that is to say those who do not lift in competition, I question if the 1-rep maximum really holds a practical purpose other than as a metric against which to measure other lifting amounts. And for these practical purposes, you're better off estimating your 1-rep max if the alternative is lifting without sufficient safety precautions.
Today, I'm gonna do some bench pressing.
A 2023 article written by Bradley A. Rupel et al. Explained that for recreationally trained individuals, that is to say, most of us, performing moderate to higher resistance loads, 65 to 95% of a 1-rep max, using 0 to 1 versus 4 to 6 repetitions in reserve, following each set promotes similar increases in strength. So, if I may be able to achieve similar increases in strength, whether I lift to absolute failure or have a couple reps left in the tank, which do you think I choose? Dr. Rupel then reminds us that the findings of Rafalo et al. In a study published in the Journal of Sports Medicine Open in February 2023, where it suggested performing an acute bout of resistance exercise at or close to failure, 0 to 1 repetition in reserve, leads to poor post-exercise recovery and worsened muscle soreness and general feelings of well-being compared to higher RIR training. It seems to me that as these studies are taken into account, the scientific importance of the 1 rep maximum begins to fade away. If I can make the same gains without failing under the bar, then why would I ever sacrifice safety to hit a new PR? In my opinion, if your reason for attempting a given weight that is heavy enough to put your well-being at risk is not based on scientific research, that is to say, if you can't tell me exactly why you need to lift this weight in order to meet your training goals, we're likely talking about ego lifting. Hate to break it to you, bro. And no, because it's badass just won't cut it. And please, for the love of all things holy, if you do decide to push a new 1 rep maximum, wait to do so until you have a spotter or spotters, there are other people nearby, and you have access to a proper lifting rack with safety bars. Your future self thanks you. Be sure to let me know what you'd like me to cover next in the comment section down below. And remember to join me at my online gym, Human 2.0, where we help you move better and prevent injuries for free right here on YouTube. If you liked the video, be sure to give it a big thumbs up and subscribe to the channel. If you didn't, be sure to let me know why in the comment section down below. Otherwise, as always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one, and teach one.